Now, hospitals in Devon are on what they call their highest level of escalation as they can't find enough staff to treat patients at the end of a momentous week of strikes.
Yes, thousands of operations have been cancelled across England, with junior doctors continuing their walkout for another 24 hours. Fiona Chapman's just one person who's been affected by the action this year, with 2 operations cancelled, and his wife, Fiona, joins us now from Cornwall. Good to see you this morning, alongside co-chair of the BMA Junior Doctors Committee, Dr Vivek Trivedi, who joins us from Manchester. Good to see both of you this morning. Shall we come to you first of all, Fiona, please? Tell us how the strikes have impacted your husband and what your husband is waiting to have done.
So my husband's waiting to go to a specialist hospital in London to have a nerve stimulator put in his scalp because he suffers from chronic migraine. He's had it all his life, but he has got much worse in the last few years, to the point where he's now being medically retired because he can no longer work due to the pain. He was due an operation in June, and this was cancelled due to the doctor's strikes with 10 days' notice to go. It was rescheduled for August and was cancelled again, and we now hope for a provisional date in October. But again, we've been told this will be dependent on the scheduling due to the doctor's strikes.
Fiona, it's just awful that he's in so much pain and this operation could make a big difference and it's been rescheduled so many times.
Yeah.
I wonder how you and your family feel about the strikes that are taking place. Do you have sympathy with the striking doctors, or do you think enough's enough now and people are suffering like your husband and we need to get them back to work?
So my husband is suffering, but he absolutely fully supports the doctor's strikes. He fully supports them getting a better deal. So he does understand, although he's desperate to have his operation, he fully supports them in getting a better deal.
So what, I mean, you must be exasperated and also terrified, really, worried that something will crop up again in October to put this back again. Let's talk to the other side of this then. When you hear cases like this, Dr Vivek, and also I'm sure you're completely aware of so many more, how does it make you feel knowing that the strikes have led to this, as a doctor who wants to do good?
Good morning. I feel, horrified that Fiona and her family and her husband have unfortunately had to have their appointments and surgeries in this instance rescheduled because of the continued failures of our government. Our government have allowed a workforce crisis to develop that has seen our waiting list shoot up by millions over the past few years before any strike action. And all we wanted to do was to have a reasonable conversation with the government about how doctors are underpaid and therefore not able to look after patients properly. But they have ignored us and have forced us into strike action and have made no effort to try and avert that strike action, which is a completely different approach to what we've seen with our colleagues in Scotland. So I'm sorry to Fiona and her family, of course, for strike action causing disruption, but it's by nature that it has to be disruptive to put pressure onto the government to come back to the table. But in both instances, the government have failed to act, and this could have been avoided in the first place.
I mean, Vivek, you chose to become a doctor because you want to look after people, you want to do good. I've got doctors in my family, a lot of my family have been part of the NHS, and I understand that urge to look after people. But I wonder how hard it is for you and your fellow colleagues to separate patient safety and what you're hearing from Fiona about her husband and many other cases that we've had in touch from the principles that you are striking over, because the two are going hand in hand, aren't they? People are suffering because you are all sticking to your principles, and we aren't seeing any movement from the government whatsoever.
So I became a doctor almost 7 or 8 years ago now, and I work as an anaesthetist. So I see patients coming in for elective surgeries, and I also look after them when they're critically unwell on intensive care. And throughout my time of working, I've only seen things get worse. I've only seen more and more patients having their surgeries cancelled, more and more patients coming in unwell because they've not been able to get healthcare in the community because we don't have enough staff, and that's what's pushed doctors to this position. Now, our strikes, as I mentioned, are designed to be disruptive, but we have made sure that we can strike safely and ensure appropriate cover by either consultants or specialty doctors who are covering for us when we're not striking, or for when we took joint strike action, we ensured that emergency services were kept into place. But unfortunately, if we don't do anything at all, we accept that the trajectories will continue. That means more patients will have to wait longer to see doctors in A&E. They'll have to wait longer to see GPs out in the community, and they'll have to wait longer to see consultants or specialists in clinic, because this government is simply not valuing doctors enough to keep them here.
The trouble is that, as you've said, and you've put the blame firmly at the government's door for not meeting you, discussing with you and trying to form the negotiation. You've said that already. The trouble is they aren't listening. They aren't coming to talk to you. And just this morning, we've heard that NHS Hospital in Devon have entered the highest level of escalation. They're saying patients will be turned away even from A&E departments because they don't have enough staff to fill rotas as a result of the strike action this week. Is there a point when the person that took that oath, as you did 7 or 8 years ago, is in too much conflict with the person who is worried about the state of the NHS and the patients within it? What's your breaking point?
So these OPAL measures that you described are things that doctors will be experiencing most days of the year, even outside of strikes. I've lived through many and worked through many OPAL levels, even to the highest levels as you describe. Where's the government taking any action to prevent that from happening? But when we bring it back to our strike action, there are regular meetings scheduled between central members of the BMA and central members of the NHS England team to monitor the situation across the country and to, take action if patient safety is at risk and if there are concerns that are put forward to us. This situation is being monitored, and that's what that process is there for.
I mean, Fiona, you've heard Vivek talking there about, how passionately he wants things to improve for the NHS, which ultimately would improve for all of us. It doesn't make things easier for your husband, Stephen. You are fully behind them, and Stephen, interestingly, is fully behind those strikes. But how long for? Because until he gets this operation, this help, he's going to be in this imaginable pain.
It is very difficult because, as you say, he is in a lot of pain. But he has steadfastly said all the way through this that he does support the doctors. But it is a shame that we have not got the situation resolved like Scotland has, and then we could all move forward and get clear in this backlog and my husband gets his operation.
Who do you blame? Who would you call out to sort this out?
I have to say, I'm not a political person, but I do wish the government would come back to the table. If Scotland has managed to resolve the situation, I really don't understand why England can't follow suit.
Well, look, Fiona, thank you for joining us. We wish you the best, and please do send our best to Stephen. Hopefully that appointment in October does happen and he can get some relief from the pain he's in. Thank you for joining us. Yeah, we'll keep our fingers crossed for you. And Dr. Vivek as well, thanks for joining us this morning.